This is Respimat. It is a drug delivery device used in treatment of various respiratory diseases. Currently, there are few brands of medication available in the market using this device, such as Stiverdi, Steel-Toe, and Spiriva. In this video, we will be focusing on Respimat Stiverdi. Stiverdi Respimat is indicated as a maintenance therapy in patients with chronic obstructive pulmonary disease, COPD, in which a patient's airway is obstructed. The active ingredient in Stiverdi Respimat is olodaterol, a selective beta-2-adrenergic bronchodilator. The recommended dose for adults is 5 micrograms olodaterol given as 2 puffs from this inhaler once daily at the same time of the day, meaning that you do not have to separate the 2 puffs.
Now that we know olodaterol is the active ingredient in Respimat Stiverdi, you must be wondering, how does it work? Olodaterol binds and activates beta-2 receptors in the lungs. This will result in activation of adenylyl cyclase, an enzyme that mediates the production of CAMP. Elevated levels of CAMP will induce bronchodilation. Therefore, the airway is open, letting more air to come in and out of the lungs. Hence, your breathing improves.
If you are a first-time user, here is what you have to do. First, see this transparent cap with a safety catch. Press the safety catch and pull off the transparent cap. Then insert this cartridge into the inhaler by pushing it gently against a firm surface to ensure it has gone all the way as you hear a click sound. Now put the transparent cap back and do not remove until you need to change a new cartridge. Alright, now I'll be talking about something important, which is to prime the device. Something you must do when you are using this inhaler for the first time, or if you haven't been using this inhaler for more than 21 days. Hold the Respimat inhaler upright like this, and you will see a tiny arrow showing you which direction to turn. Turn to the indicated direction until a click sound is heard, like this. Now open the cap and press on this darkened part of the device. Repeat for a few times until a plug is visible, like this. Then repeat 3 more times to be really sure that it is ready to use.
Remember, for this Respimat inhaler, you don't have to prime every time before use. However, if you have not been using it for more than 7 days, do release the first puff towards the ground before using. For daily use, follow this demonstration. Hold the Respimat inhaler upright with the cap closed. Turn the lower part of the inhaler following the indicated direction until you hear a click sound. Exhale or breathe out fully to expel as much air from your lungs. Open the cap and wrap your lips around the mouthpiece without covering the air vent. Make sure the inhaler points toward the back of your throat. Now breathe in slowly, and as you breathe in, press on the button to release a puff and continue to breathe in slowly. Hold your breath for 10 seconds or for as long as you feel comfortable. Now exhale gently. So remember the key points. Turn, open, press. Cleanliness is very important. Clean the mouthpiece of your inhaler, including the metal part inside, with a damp cloth or tissue only for at least once a week. Never ever try and soak the device or wash it under running water. If you can see the scale right here with the green and red zone, this actually tells you how many puffs you have left with this inhaler. When the pointer enters the red area of the scale like this, you have approximately 30 puffs left. Once the cartridge is empty, this device is auto-locked and you will no longer be able to turn the device like this.
Side effects of Respimat include upper respiratory tract infection, urinary tract infection, dizziness, sore throat, or cough. Some may also experience runny or stuffy nose, constipation, and diarrhea. The least common side effects would be rash, fever, back pain, and also joint pain.
Stiverdi Respimat is contraindicated in patients with hypersensitivity to olodaterol or any of its excipients. Stiverdi Respimat is only for chronic obstructive pulmonary disease, COPD, and not for asthma. Do not exceed the recommended dose as it can be fatal. Stop this medication immediately if your breathing and wheezing worsen. Lastly, no sharing of this medication with others. Remember, Respimat is not a treatment of choice for acute symptoms of COPD.
Hello, can I include Patricia? And do I need to bring my prescription?
Stiverdi is only sold in the pharmacy as a single pack, which contains 1 inhaler and 1 cartridge. Remember, 3 months after the first use, Stiverdi should be discarded. This medication is classified under Group B, where it can only be dispensed with a doctor's prescription. For more information, visit www.stiverdi.com or scan the QR below. Congratulations, you are now a Respimat Inhaler Pro.